Hello, everyone. My name is Antonella Aguirre. I am a student of Catholic University Santiago of Guayaquil, and my topic research for today is disseminated gonococcal infection. Well, um, the definition. Gonorrhea is a sexually transmitted infection, a STI caused by the bacteria Neisseria gonorrhea. Anyone can contract it, and the infection typically affects one or more of the following body parts, like urethra, throat, rectum, and the cervix. Disseminated gonococcal infection (DGI) results from bacteremic spread of the sexually transmitted pathogen Neisseria gonorrhea, which can lead to a variety of clinical symptoms and signs, such as arthritis or arthralgias, tenosynovitis, and multiple skin lesions. DGI occurs when the sexually transmitted pathogen Neisseria gonorrhea invades the bloodstreams and spreads to distant sites in the body, leading to clinical findings such as septic arthritis, polyarthralgia, tenosynovitis, petechial or pustular skin lesions, and bacteremia, or on rare occasions, endocarditis or meningitis. Well, here we have a image or the bacteria Neisseria gonorrhea and how these bacteria affects in the body.
Assalamu alaikum, dear viewers. In this video, I'm discussing about gonococcal infections. So, what is the organism responsible for gonococcal infections? That is Neisseria gonorrhea. Remember, Neisseria gonorrhea, that is a gram-negative diplococcus, is responsible for gonococcal infections. There is similar name, gonococcal and Neisseria gonorrhea. Now, it is a sexual transmitted disease. It do some effects on female and male. What happened on male? There is development of urethritis, epididymitis, prostatitis, pharyngitis, and conjunctivitis. Remember, in gonococcal infection, in male features are urethritis, epididymitis, prostatitis, pharyngitis, and conjunctivitis. And in case of female, gonococcal infections features are cervicitis, PID, that is pelvic inflammatory disease, pharyngitis, and conjunctivitis. So, in case of female, Neisseria gonorrhea or gonococcal infections causes cervicitis, pelvic inflammatory disease, pharyngitis, and conjunctivitis. Now, there is an infection occur, disseminated infection. So, other features also present. These are fever, chills, rash, tender pustules, tenosynovitis, and septic arthritis. These are also present. What is the treatment of gonococcal infections? Treatment is empirically treat for chlamydia. If uncomplicated case, then we give ceftriaxone plus azithromycin single dose. Then in case of pelvic inflammatory disease, we give ceftriaxone and doxycycline. Duration of treatment is about 10 to 14 days. And disseminated features present, then we give ceftriaxone intravenously. So I am again repeating the treatment portions of gonococcal infections, and that is empirically treat for chlamydia, uncomplicated condition, ceftriaxone plus azithromycin single dose. In pelvic inflammatory disease, we give ceftriaxone and doxycycline, and the duration is 10 to 14 days. And disseminated case, we give ceftriaxone. So, this is all about gonococcal infections. Please do subscribe and share Dr. Amma's Medicine YouTube channel. Thank you.
Well, the applications in medicine. The definitive diagnosis of disseminated gonococcal infection, DGI, or gonococcal arthritis is made through the identification of the etiologic pathogen in a specimen taken from a non-mucosal site, such as blood, synovial fluid, or skin lesions. And for another hand, patients with DGI should be treated for at least 1 week with intravenous ceftriaxone, and the treatment duration should be extended in patients who do not improve adequately. Rash associated with DGI disappears after 4 or 5 days without correct treatment. Also, the clinic is very important for orientation, especially if they present the typical triad and a good anamnesis, collecting data on sexual practice, pregnancy, menstrual history, and the menopause. Mucosal samples should also be obtained and are often useful in patients who have a high index of clinical suspicion for DGI. The amplification test is preferred 10 nucleic acid NAAT, which is taken through urine, vaginal smears, and vaginal health and or rectal smears as supporting evidence for DGI and to rule or co-infection with C. Trachomatis blood cultures have less than 10% sensitive with slightly higher yields during the early stage of dissemination. Endocervical swab is positive in up to 90-10% of affected women. Pharyngeal swab in 50% and 75%, urethral swab in 20%, and rectal mucosa swabs in 15 of the cases.
Welcome to Dynamic Medicals. Today in this video, I am going to talk about the gonococci, its morphology, cultural characteristics, its antigenic structure, clinical features, and the lab diagnosis. Let's start with morphology first. Gonococci is a gram-negative cocci. Its shape is pear-shaped or bean-shaped and it possesses a pili on its surface. It's capsulated, non-motile, non-sporing, arranged in pair with adjacent side concave. Its cultural characteristics are that they are aerobic but can also grow anaerobically, cannot grow on ordinary media like an optimum temperature. It's 35 to 36 degrees Celsius. Its pH is 7.2 to 7.4 with 5 to 10% of CO2. Media required are Thaler-Martin medium, modified Thaler-Martin medium, blood agar and chocolate agar. Biochemical test: catalase positive, oxidase positive. Utilize glucose only with the production of acid. Its antigenic structure is pilar protein for the attachment. It inhibits the phagocytosis over the membrane protein. Lipopolysaccharide. Its toxicity is due to the endotoxin effect. Let's start with the clinical features. In males, it starts as an acute urethritis with mucopurulent discharge through urethra, also conjunctivitis, proctitis, water can perineum. In females, cervicitis, salpingitis, proctitis, conjunctivitis, arthritis, and the pelvic inflammatory disease. In prepubertal girls, vaginitis, vulvovaginitis. In newborn babies, gonococcal ophthalmia. Let's start with the lab diagnosis. Microscopic examination. In that, gram stain, fluorescent antibody technique, antibody detection, ELISA, radioimmunoassay, and the heme agglutination. Thank you so much guys for watching the video. Please do like, share and comment on my video and subscribe to my channel Dynamic Medicals.
Now we have the pros. First, the treatment for gonorrhea is effective. The treatment reduces these complications and Use barrier methods like condoms when you have sex. Also, the treatment for DGI typical lasts 7 days. There are plenty of no and low cost ways to get tested for sexually transmitted infections, the STIs, no matter where you live. And there are 6 main types of STIs. And for another hand, we have the cons for this disease. For example, many cases go undetected. Also, there are rashes and inflammation of the joints, gonococcal endocarditis, which is damage to the inner lining of the heart muscle, gonococcal meningitis, which is in an infection of the membranes covering the brain and spinal cord, the infertility, as the infection can spread into the fallopian tubes and uterus in women. Also, there's the epididymitis in men and the blindness and scalp sores in babies. Neisseria gonorrhea infection can facilitate HIV transmission, and the babies born to infect mothers are at risk of ocular infection, which can lead to blindness. So now we have some pictures that this disease, we can observe the inflammation and the pain that suffer these patients. So, well, this issue applied in Ecuador, disseminated gonococcal infection, DGI, is estimated to occur in 0.5 to 3% of patients infected with Neisseria gonorrhea. According to the WHO in 2005, each year, 4.48 million sexually transmitted diseases occur, including gonorrhea, and the average age of onset is between 50 to 49 years. In Ecuador, according to INEC, in 2010, sepsis in the neonatal period was the sixth leading cause of infant morbidity and the fifth leading cause of mortality. Ecuador is in the process of carrying out the study of resistance to ARVs that defines the basally and in this way obtain the statistic adjust to our environment. In addition, this will allow us to define the most effective treatment regimes. We have another pictures of this disease. We can be our edema, inflammation of the parts, cause arthritis, and
Gonoccocal arthritis symptoms, causes and complications. Gonoccocal arthritis is an inflammatory condition of the joints caused as a complication of gonorrhea infection by Neisseria gonorrhoeae bacteria. It mostly affects sexually active teen girls than men. Gonoccocal arthritis is the most common form of septic arthritis among sexually active people with multiple partners. Symptoms of gonoccocal arthritis. Gonoccocal arthritis develops in about 50% of people who are infected with gonorrhea. The symptoms of gonorrheal arthritis are polyarthralgia or pain in multiple joints, sometimes migratory pain, tenosynovitis or inflammation of the tendons, skin rash which is pink in color, later turns red and finally purple in color. In some of the cases, the rashes are filled with pus. Fever, pain and burning during and after micturition, pain and redness at affected joints, decreased ability to move the joint, sudden onset of pain. In some cases, a headache is accompanied by pain in joints, irregular menstruation, sore throat, painful sexual intercourse, pain in the lower abdomen, pelvis, testicle or vaginas, abnormal vaginal discharge or discharge from the tip of the penis. Causes of gonoccocal arthritis. Gonoccocal arthritis is caused by a complication of gonorrhea. The infection is sexually transmitted and mostly seen in sexually active women girls. Gonoccocal arthritis is a condition when the bacteria affect joints of the body, causing inflammation of the joints. Gonorrhea is transmitted sexually from one partner to another during sexual encounters, which include oral, anal or vaginal intercourse. Diagnosis of gonococcal arthritis. Neisseria gonorrhoeae bacteria, which causes gonorrhea, is very fragile microorganism, which makes it very difficult to culture, so samples of blood, synovial liquid, genitourinary tract, rectum, pharynx and skin lesions must be sent for culture before starting any antibiotics. Risk factors of gonococcal arthritis. Women are at higher risk of developing gonococcal arthritis. Unprotected sexual encounters with multiple partners. Having sex with a sex partner who has multiple sex partners. History of gonorrhea infection. Having other sexually transmitted diseases. Young women are at higher risk. How to prevent getting this condition. Gonococcal arthritis can be prevented by reducing the risk of getting infected. To reduce the chances of getting infected with gonorrhea, one must use the following precautions. Using condoms while having sex with a new partner, which includes using a condom during indulging either in oral, anal or vaginal sex. Go for screening regularly to the doctor to get screened for gonorrhea infection. Having sex only with reliable sex partners, who are tested negative to all sexually transmitted diseases. Do not have sexual intercourse who has unusual symptoms such as burning sensation, unusual discharge or rashes on their genitals. Do not have sexual intercourse who has unusual symptoms such as burning sensation, unusual discharge or rashes on their genitals. Untreated gonococcal arthritis can lead to the following complications. Infertility in men. Infertility in females. Increased risk of getting infected with other sexually transmitted diseases. Infections can spread from joints to other parts of the body like eyes, rectum or throat. Babies born to mothers who are infected with gonorrhea at the time of birth can develop blindness, sores on the scalp, and some other infections too.
As a conclusion, in conclusion, female sex is considered a risk factor for contracting disseminated gonococcal infection. But in recent years, there has been an increase in the number of cases in the male population due to the increase in homosexuality and oral sex practice. As for its definitive diagnosis, it is made with the evidence of Neisseria gonorrhea in a non-mucosal seed, and in the second-line mucosal test, the nucleic acid amplification test NAAT, being of great interest, which shows great effectiveness for the detection of Neisseria gonorrhea. Due to the resistance of the gonococcus to penicillin, tetracycline, and fluoroquinolone, its use has been discontinued, replacing it with combined therapy of ceftriaxone and azithromycin. So, thank you so much.